Thank you so much. I appreciate it. Andrew, have you visit a little bit about health and wellness and even utilizing out-of-school time programs? And then would you introduce yourself briefly before you begin speaking? Perfect. Thank you.
Sure. My name's Andy Masters. I am the Youth Health and Wellness Lead at the Baltimore City Health Department. Like Olga, I'm a admitted long-winded person, so I too need to start a stopwatch, though I won't look at it, let's be honest. So I came to this work seemingly rudderless, but it really does make sense. So I started off as a school counselor in Southwest Baltimore, coming from a rural college, relatively rural college, and when I got to an urban district, I had no idea what to do. My grad program didn't prepare me for what to do when a kid gets run over by a car outside of school running to a fight. It didn't prepare me for what to do when a teacher dies. It didn't prepare me for what to do when a kid gets stabbed in the classroom by another student and dies. What it did allow me to do is understand that I play a critical role in a school, and I was the only school counselor in a school of 450 kids. I believed very much in the work that I was doing, and I felt completely powerless. I felt completely unprepared for the work that I was doing because I knew who the kids and families are that needed the supports, but I had no idea where to find them, right? In a city like Baltimore where there's so much happening, I had no idea what it was, how to find it, how to get folks into it. And when I could, when I found them, I used them up really quickly, right? And so shortly, one family would have resources, and then 5 families would be on a wait list. From there, I moved to the central office running the district's RTI process and the middle and high school choice process. Same thing. Like I knew when kids came across my office or schools came to me and said, I don't know what to do, when I was honest with myself, I said, neither do I. And I tried to help them think it through, but I didn't have the answers. So after a couple of years of doing that and, 8 years in city schools as a whole, I moved over to the community schools intermediary in Baltimore, Family League of Baltimore. And I ran the community school strategy for all of our elementary and middle schools. This seemed to be the answer. It seemed to be what was missing because here was a strategy that was working to put community-based organizations in schools in partnership to find resources, find partners, find organizations that can work to meet the holistic needs of kids and families. Amazing work. I was there for 2.5 years, and during that time, the city health department, which has a very successful infant mortality reduction strategy, Be More for Healthy Babies, which over the last 7+ years, we've seen infant mortality rates drop by 30%. We've seen sleep-related deaths cut in half to the lowest recorded levels ever. We have made innovations and changes to the way that services are delivered to pregnant and parenting moms. And so when our health commissioner came in, she wanted to replicate the success of Be More for Healthy Babies for kids ages 6 to 19. Understanding that what works about Be More for Healthy Babies is that it is a collective impact strategy that's facilitated by the health department, but isn't the health department's. It really does belong to the city with over 150 partners working around a common goal of reducing infant mortality. So after a 2-year planning process, of which I was a significant part of, I drank the Kool-Aid, right? Like I understood that this is what was needed, and this was the next step. If community schools were the answer, the strategy was the roadmap to get there. The youth health and wellness strategy. So, like Tom, this thing is totally for me. Honestly, there's not a lot of information on it, and that's intentional because I just death to PowerPoint and all of that. So our vision for the youth health and wellness strategy is we see a Baltimore where all young people ages 6 to 19 are safe, engaged, and prepared. When we started this, that vision didn't exist. We went into and talked with communities and young people, and originally we had 3 high-level impact areas that I'll show next. When I talk with young people, I ask them this question, right? And that the question is, what does this mean to you? Because folks used to ask me, and I don't know what this means as far as this strategy goes. When people talk about safety, kids, they don't talk about physical safety first. They talk about the emotional safety of what it's like to grow up in Baltimore. They talk about the need to feel safe in your own home and in your own community. A lot of what Olga talked about in her story happens on a daily basis in every housing project in Baltimore. It happens on a daily basis in just about every community in Baltimore. Every one of our kids has experienced some form of adverse childhood experience. In Baltimore, I think the extrapolated numbers are the kids experience an average of over 2 ACEs, which puts kids at a much greater risk for poor outcomes. So when they talk about safe, we talk about emotional and safety first and then physical safety. When you look at it per capita, Baltimore has more homicides per person than Chicago. We're just not as big. Then we talk about engaged. We want kids, when we first started this, when we first developed this, it was engaged in school. And I love talking to kids. Adults are great, but kids are awesome. And so when I first started, and they've developed this, like this is not my unique idea. We talked about engaged in school, and they pushed back on us and said, we don't want to just be engaged in school. We want to be engaged in the community. When you look at the uprising in Baltimore a couple of years ago, it was led by young people. It was young people. It was young people who got fed up of not having a voice and feeling that they were being taken for granted, taken advantage of. So we removed the in school, and our young people, we see a place where Baltimore youth are engaged in school, engaged in community, engaged in government, engaged in organizations, and just overall engaged in their world. And then prepared. What does prepared mean? We started with making healthy choices, and the challenge with that, and the young people told us, like, making healthy choices implies there are choices to make. And over a third of all Baltimore young people, I'm loud, I'm shocked that I even need this, and over a third of Baltimore's young people live in a food desert. They don't have access to fresh fruit. They don't have access to grocery stores. They have corner stores. They have chicken box shops. They have carryouts, right? And what we know is our corner stores don't carry fresh fruit because nobody buys it. When they do carry it, it goes to waste, so they stop carrying it. So our kids can't get those things. And so we set them up as a society where we put these things in place over time and generations, where we've set our communities up in a way that keeps people of color exactly where they are, right? And the lack of food, the lack of financial institutions. Most of our communities don't have banks. So when they get paid, if they can get paid, because there's no jobs either, but if they get paid, they got to go pay somebody to give them their own money. We continue to set up the institutional racism that Olga talked about that's happened for generations. Baltimore is a pioneer in how we socially organize cities to keep people of color over there. So how do we get there, right? Where is there? So we developed 3 measures of success. And before we had the vision, we just ran with this, right? Young people, this is how we know we're going to be successful. We're going to see fewer child fatalities, fewer missed school days, and fewer teen births. And very quickly we heard, that is atrocious. That makes us seem like all we do is skip school, get pregnant, and die. Legit. That's how come we came to the vision that we did. Because while these are major and significant indicators, and while these we believe are going to move the needle, and help us achieve that vision, this isn't really what we're going for. We're not trying to take away. We want to give back to Baltimore. We want to provide the opportunities for young people to be that positive vision, not just to be less negative. Coming from that youth development perspective, really making sure that young people have a voice, that young people are valued, that young people are the center of the work that we're doing, and everything that we do is responsive to them. This thing has gone through a million iterations. Sometimes I'm nervous about what Prezi I'm showing because it might be like 2 weeks old, and that's a problem. So those are our measures of success. Sounds great. How are we going to get there? Similar to Be More for Healthy Babies, we have a rallying cry, but unlike Be More for Healthy Babies, we have 3 different indicators. Because when you're talking about 6 to 19, you're talking about kindergarten to potentially your first year of college. And there's no one indicator that's going to capture all of that. And then there's no one way to get there. So we went through a 2-year planning process to get to the point where we knew we had an idea through the development of a logic model and action plan, like what we needed to do to get there. And we work from an ecological framework where we're operating at the policy level, the systems level, the community level, and the individual level. But when I talk about that, that's not all that sexy. When you're talking about that with young people, they gloss over and, so we organize the work around three big themes. And those three themes are healthy minds, healthy bodies, and healthy relationships. So within each one of those, we have a couple of priorities. For healthy minds, our two priorities right now are two big impacts. Like if we can do this, we'll start to move the needle. Our improving mental health is the first, and through that, and Olga's very familiar, we have an expanded school-based mental health model where in partnership with the school system and our mental health authority, behavioral health authority, give small grants to community-based partners to place a part-time provider, mental health provider in schools to do unfundable services, right? The things that you can't get reimbursed for, the school-wide initiatives, the SST meetings and all of those. And then the provider's expected to make up the rest through fee-for-service. But we're able to provide the foundational work to put somebody in there. And then we also have a grant from the Department of Education, the school system does, called Promoting Student Resilience, that in a small area of Baltimore, in the one that many people saw the worst of on camera for days and days and days, we're working to provide that expanded school-based mental health at a full-time level in all of those schools. We're also working to do trauma-informed care training for every person in the school system, right? From the principals to the custodial workers. When I talk about trauma, when I talk about school climate, I ask the question, who's the first person that your kids see when they walk into school? And the answer is the lunch lady, like the cafeteria worker when they walk in for breakfast. And if your cafeteria worker is stank, that kid's day is off to a bad start. So when we talk about trauma-informed care training, we're not just talking about principals and teachers and school counselors and social workers and psychologists. We're talking about every adult that talks to a kid. So that's just one. The second is substance use prevention and intervention. And these are all things, by the way, that we're already doing. So we have a coalition preventing substance-exposed pregnancies because we see the circular relationship of the youth health and wellness strategy along with the Be More for Healthy Babies work. Oh, boy. So I'm going to have to speed it up. Through Healthy Bodies, we have sexual and reproductive health. So again, an $8.5 million grant to do sexual and reproductive health education in classrooms from the Office of Adolescent Health. And then food access. I talked at length about our food access challenges, and these are some of the things that are already in place. And the third here is physical care. So the health department, Baltimore City Health Department, does a lot of work in partnership with others around immunizations, vision, dental care, asthma prevention, and treatment. So we want to make sure that all of those things are happening in a connected way. So the third bucket, I love the word bucket. It's one of those non-profit-y catchphrases that means nothing. So healthy relationships, the first thing we're looking at is how do we reduce violence? I spoke about that a little bit, and we do that through a citywide collaborative, the Be More for Youth Collaborative, Safe Streets, which is built off the Cure Violence model, where we use trusted messengers, ex-convicts, ex-felons, gang members who go in and intervene in possibly violent situations out in communities. And then we have school-based violence prevention work through PBIS, restorative practices, things like that. The other piece is preventing and healing trauma. So we have a citywide trauma approach that we're developing in partnership with the school system, the Behavioral Health Authority, community providers, community members. And then a grant from SAMHSA, Recast West Baltimore. This is a grant that's provided to cities that was eligible for cities that had experienced civil unrest in the last 24 months. And Baltimore was able to secure that grant funding. And, that grant funding really helped us to understand, again, the way that the health department really perpetuates racism, really is institutionally in a way that by default, because of the way that we've operated as the oldest health department in the country, our work really does continue to perpetuate systems of oppression. And this grant, we did it the way we always do. We saw money, we brought our friends together, we wrote a proposal with people that do good work and have experience. When we went to the community, they told us in unkind terms that this is unacceptable, that we're tired of white-run organizations coming into black communities telling us how they're going to fix us. and they pressured us, and we had to do a quick pivot because we recognized the value in what they were saying. And so they said things like, there are great organizations in this community that are doing great work, you just don't know who they are. Because the way grant making happens is exactly what you did. You called the people you already knew, who already had the grants, who already did the work, and you just gave them more money. Where we on the ground are struggling with pennies. We place community members in control. They are able to direct $170,000 of our first year's budget to wherever they want to, within reason, to meet the needs that they see as the most important. Because we know that we don't know. One of the things I know I personally learned from this is that I have no idea what it's like to grow up in public housing in Sandtown, where every day there's homicides. Every day there are folks that are getting robbed. Every day the parents are walking past drug deals on the street. Every day folks are worried about whether or not their neighbor, their friend, their cousin, their uncle is going to get shot. Because that stuff happens so much. I remember when I was a 5th grade counselor and the kids were talking about a shooting that happened in the community, and they were upset that they had to go inside. Like that was it. It wasn't about the person who got shot. It was about that they had to end their basketball game early. And our kids, that constant level of trauma makes it so that when our kids walk into school, when our parents walk into school, they're automatically in fight, flight, or freeze. So think about every kid in an urban district. You can see that every day because they come into school with that. And the way that we work through this strategy is to bring together partners and friends and community members from across all sectors to be able to rally around kids. But it's not just rallying around kids, it's also placing kids at the head of the table. We met with youth-led organizations all the way through the development of this strategy, and they helped us all along the way keep the ship on track. And so the ways that youth are directly involved is they have peer connections. They bring kids to the table. I only know who I know, right? And I know the people that know me, so naturally there's selection bias there. So our young people are able to get us to the young people that never get to the table. Through developing communication and messaging, again, the youth health and wellness strategy is the least appealing name to anything ever. So as we move into this is only launched 6 months ago. So as we move into this, the branding and renaming of the strategy is going to be youth driven. And then working towards a system of youth leadership. And it's really important for me to say it that way because we're not youth led. Because youth leadership is along a spectrum, and youth led means that that kids are in charge, making decisions with ultimate authority. Very few of us actually do that. A lot of us survey young people and then do whatever we wanted anyway. A lot of us may have young people on our boards, but they don't actually get a vote, right? Many of us take recommendations and try to do. So we're working along a structure to get to a point where young people are in a leadership position. This work is complex, it's complicated, and it's across a lot of different groups. One of the last things, and we can talk about this more too, is one example of the way I kind of jokingly say I don't do a whole lot. My job isn't to do. My job is to bring together the folks that are doing and make sure that they can do it better. But a lot of times I find gaps. One of those gaps was, how do doctors and schools talk? And what happened through a bunch of interviews is we identified 3 challenges, right? Communication, data, and parent bandwidth. Anybody that's ever worked with a parent understands that parents are at the center of every system of support. And every system has just that one little thing they need a parent to do. Yeah. But when you've got 8 or 10 systems that are asking parents to do one little thing, all of a sudden that Vanderbilt you gave them in your office becomes the least important thing because they have no idea how they're going to get home, where home is, how they're going to feed their kids, what they're going to do about their kids' asthma medication because they couldn't get it. So your Vanderbilt gets shoved in the bottom of a purse and forgotten about. And so bringing doctors and schools together, we have a work group that meets monthly, and it includes chief medical officers, pediatricians, nurse practitioners, principals, community school coordinators, school social workers, assistant commissioners in the health department, school nurses, the head of the school system's health folks, the attendance office, all to understand, how do we do this better? What can we do And not just what can we talk about here and then go our separate ways because Andy fed us good dinner, but like what can we do? And so we're starting to develop these white papers that we're going to pass out first in Baltimore and then across Maryland that says, this is what you can do. This is the role that a medical professional can play in the special education process, because they don't know. And then we're also working on a great pilot to get student attendance information into the hands of doctors via our state's health information exchange, so that when doctors are talking with kids, they also can advocate for positive attendance, but they can also use attendance as a marker of chronic health concerns. All right, so I'll stop because I went way over time.